face down. All right, closing thoughts on Alex. Pretty ideal case. It's not always that easy. It's part of the reason I started these videos is I wanted people to see real, true healing and recovery. Because all I really see out there on the internet is, you know, they get one adjustment and it's a miracle every single time. And any real doctor, chiropractor that works with people, personal trainer, PT, anyone will tell you that is not, it does happen, but that is not how a lot of them go. So, so with Alex, I mean, it's been a week. He's been holding his adjustment great. He's only needed one. He's been going, he started at 30 pounds to the left. Now he's been about 5 to 10 pounds on the left. So a huge improvement there. Legs are nicely balanced. Again, his neck on the x-ray is still off. It hasn't moved, but head tilt better. Rotation is cleared. Upper neck is level. And that is that's taking pressure off the nervous system, and his physiology looks great. So we're gonna leave it like I explained, and then he'll heal through that, and eventually we'll clear the neck. But he's doing way better. He'll continue to heal and do better. We'll give him some at-home stretches. We've already given him 1 or 2. We'll give him some more. As long as he does that, he stays consistent. We make sure he continues to hold. He's gonna do really great. I'll do a follow-up video in a few months, and we can document, because there'll be ups and downs like anything with stress and fatigue, but he'll do great as long as he stays consistent and he does his at-home stuff and he keeps coming in, so we can make sure. But we'll probably do twice a week for another week or 2, and then go to once a week, and then we'll just slowly taper him out to every 3 months. So it went really well. Kind of an ideal situation. So nice when that happens. Doesn't always happen all the time. So if you have any questions, leave them in the comments. If you know someone this could help or benefit, please share it with them. If you want to see when our videos are coming out right away, subscribe. And remember to take charge of your health. Have a great one. So how are we coming along?
I was 60% better than the day I walked in.
Awesome. Okay, and that was basically a week ago. Awesome. Yeah. So sleeping better?
4 or 5 hours at a time now.
Awesome.
You know, being able to sit down.
What was it when you started?
I couldn't even sleep an hour.
Wow, that's great. Okay.
Drinking a lot more fluids, water, keep you hydrated, because it doesn't feel like a chore. It feels like it's part of the healing process.
Yeah, awesome. Good. Cool. So walking better, sleeping better. Work, I know your work's pretty physical. How's that?
I can work for, like I said, about 4 or 5 hours at a time.
Good.
You know, and
awesome.
Sit down and then, you know, have the motivation and, you know, perseverance to get up and do more. So
right on. Awesome.
Yeah.
Well, let's check your standing. Let's see how. X-rays are a lot better. The head tilt is gone. Upper neck is more level. The lower neck hasn't moved, but sometimes that happens. So we're gonna have to just let that hold in place, and eventually you'll heal through.
Almost 20 pounds difference.
Yeah, that's right. It started when it's 30, now it's about 10. Yeah. So that's a huge difference. Let's see how the legs look. That's good. Okay. That's really good. So, let's see how you go. On your back. Start. Yeah, legs are balanced. Beautiful. Really good. Really good. And let's have you go face down. Lift your right leg straight up. Good. And down and the left. And down. One easier than the other?
Right, maybe a little bit, but
yeah, it wasn't too, it was pretty darn good.
Yeah.
Come on up. So, we're gonna have you go do the traction. How's the shoulder?
Monday actually had said that I have this top rib is under my scapula, so to do these snow angels.
Yeah, good.
Looking down.
Yep.
And then bring across.
Good.
You know, with a lacrosse ball.
Yeah.
Where your thumb is at home,
Yep.
But you know,
it'll take time, but it'll come.
Yeah. I mean, she definitely worked it out. Like, yeah, that spot right there, and while I'm looking down across.
Yep.
And then bring it all back together.
Yep.
I'm just kind of training that, you know.
Yeah. Be consistent with that, and it will come.
It's definitely from that car accident. So.
Yeah. Yeah. This is gonna take time. So that to heal. Okay. Yeah. So I'm gonna have them. So I'm gonna have them laser that kind of trapped shoulder area, upper back. Then we'll do the traction, and we'll just check you next week. And things will maybe do a follow up in a month or two. But just things will continue to heal. There's probably some ups and downs still, but it will continue to improve with this holding and healing and consistency. So, but a ton of improvement for just a week. So really, really good, Alex.
It's amazing. Thank you.
All right. So we checked Alex again. He was holding. He was doing better. We adjusted, and then we have now post x-rayed him, and this is what it looks like. So on the vertex, he went from about 3/4 of a millimeter to a little under a half. So improvement there at C2, and that's really, really important. The atlas basically cleared from 1 1/4 to basically nothing. So rotation is much better. That is a good sign. And now the hips, there wasn't much there to start with. I checked, those are still level. So here we go. So here left is where he started, right is where he is at now. So he had about 1 1/4 degrees of head tilt, that is gone. So that head tilt is gone, that's a huge improvement. Upper neck was about 1/16 of an inch low, now it's level. So neck is the same. All right, and this is always a tough call. So hips stayed level, head's better, upper neck's better, neck is the same. Sometimes with these cases where they've had a lot of trauma and severe trauma, and then you also have to take into account his physiology. So he was standing more centered, he held it, his weight distribution was way better, it went from like 30 pounds to 10, and his legs were balanced. So posture too, sometimes it can take a while, but everything is, most things are better on x-ray. His posture is better when he stands, which sometimes takes a while to change, and his legs are balanced. Now, if his posture when he stood was off or had changed, I might go after this. But when you analyze this x-ray, what it's telling us is we should adjust higher. And if we go higher, this is really important for docs to understand. So we came 2 1/4 inches higher. If we come higher, what we're gonna do is put pressure here. So we're gonna be pushing pressure from the atlas down onto C2, and that's gonna cause pressure on this facet joint, and that's gonna push that upper neck over further, and that lower neck's gonna go further and further this way. And because his physiology is good, and the number one thing I look at is if the x-rays are all better and his legs are balanced and relaxed, then I leave it and I wait. Because sometimes it takes a while for the muscles to get strong enough for the posture to consistently change. His has, but if it hadn't, but the legs were balanced, I would still leave it. Because everything is, almost everything is better. And sometimes those necks, he just needs to heal. And so I'm gonna let it heal. It could be a few weeks, could be months, it could be years. I've seen it happen as quickly as in like probably a few days to a week. Usually it's months to a year. But if he holds and heals, eventually this misalignment is going to change. He's gonna heal through one trauma, and then this misalignment is gonna change, and then we'll change how we adjust him, and then we'll go after getting this neck centered. if he stays consistent. So that'll be a big part of it. We need to make sure it stays in this position and he avoids any other traumas. So, but that's what we're gonna do. We're gonna leave it. He's feeling way, way better. His physiology, he's holding the adjustment. His physiology looks much better. His legs are nice and balanced and relaxed, meaning his nervous system is functioning much better. So we're gonna leave it, let the body heal, let the body do what it does. The body's very, very smart. And eventually it will change, and then we'll take new x-rays, and then we'll change the adjustment at that point and go after centering that neck. But I, many times early on, would try to make everyone perfect. And in doing so, they would go from being really good to being terrible. And at the end of the day, patients just want to feel good. So they don't care if like, oh, my neck's still off a little over 3 degrees, whatever, I feel great. They don't care. So, but normally when his misalignment changes, when he heals through this one, normally you'll see the symptoms change. Not always. I have seen a few people that get the same symptoms even though their misalignment changes. But most of the time, 80-90% of the time, you'll see the symptoms change. Most of the time, you also see their misaligned posture change. And a lot of the time, you'll see the short leg change. Not always, but most of the time. But the symptoms, so if he comes in all of a sudden and he's now having all these new symptoms, maybe he's got weird headaches he's never had before, he's got weird pain he's never had before, then I'm gonna think right away we need to take new x-rays. Your misalignment has changed. And sometimes the posture will go with it, sometimes it won't. But all right, so that's why I decided to leave this. I hope that makes sense. If you have any questions, please leave them in the comments. All right, Ox, how do we respond to the first adjustment?
I would say that a lot of pain I had in my thighs from, just you doing the NUCCA on the one side of my ear released down. I noticed like the whole hour or two once I got home, I could feel a release of pain going down and out the tips of my toes.
Awesome.
And I slept better, and I drank plenty of water. Just took
Good.
it light, and I think I responded to it well.
Awesome. Great. Well, let's check you standing, see how much you're leaning or not. And look straight ahead. You held quite a bit. Leaning a little bit, but a lot less, only about 10 pounds-ish instead of 30.
Yeah.
That's very, very good. Let's have you lay on your back. I'll get you a pillow.
Okay.
Good. Yeah, that legs are balanced too. Left was contracted, so that's very, very good. We're just today going to look to release some tension. We'll get you set up for the re-X-ray and make sure everything looks good there. Good. All right. And let's have you go face down. Good. Lift your right leg straight up. Good. And the left. Good. One easier than the other?
Yeah, the right. It's easier.
Where do you feel it when you lift the left? Where do you feel the tension or the resistance?
The top of my right thigh.
So you feel it over here?
Yeah, but more on the front.
Front. Oh,
yeah.
Okay. And lift the right. Good. And the left.
Yeah, the pain went down to my knee, but not in the thigh anymore.
Go on your back. Right knee.
Yeah, oh here.
Okay.
seeing stars.
And face down. And lift the right. Good. And the left.
Oh, much better.
Awesome. Okay. The left neck, any change with that at all, or still about the same?
I'd say it moved down more into my my deltoid, my left
Shoulder?
Yeah, a lot more tightness actually.
Okay. Good. Let's have you sit up facing this way. I'm going to check the shoulder.
Yeah, shoulder hurts so bad since the accident a few weeks ago. All in here, man. It just cracks like crazy. Yeah, right where your thumb is. It's just.
Yeah.
Oh my gosh.
Actually, turn facing this way. Let me get kind of a little different angle here. There you go. All right, this is going to hurt a little bit. We're going to work on this muscle. Turn your head to the right. And then while looking that way, look down.
Oh.
Yeah. Okay. And come back to center. We're going to do it one more time. The SEM muscle is really locked up. Look to the right. There we go. And look down.
Oh my gosh.
Yeah. Okay. So that's times when there's sprain, strain up in here, you will get referred pain down into this area.
Yeah.
That's going to just take time to heal.
Yeah, for sure.
But we will work on it.
It's getting less pressure by the second. It's like a heat sensation, even in the front of my chest.
Mm-hmm.
Which every time I sneeze right now, which is like 10 times a day, it's just...
Yeah. It's all that spinal pressure. And a lot of this pain is also referred pain from in here.
Yeah, I bet. Oh my gosh.
Yeah, sorry.
Sorry.
Okay, so we're going to have you do some traction. It'll do the whole spine. And then we'll set you up for a re-x-ray.
Yeah.
And then we will go from there.
Okay. I can look to the right a lot better.
Good, yeah.
Yeah. Range of motion is much better just from that.
Yeah, it's just working out. Those muscles a lot of times contract when you're injured like that, and they can have adhesions, and sometimes you just got to work it out.
Okay.
Some people call them trigger points, whatever. But yeah, sometimes you just got to work those out, and then it can make a huge difference in how it's kind of like almost gravel in there as it's trying, the muscles and soft tissues are trying to move, and it just makes mobility difficult. So yeah, I mean, a really good response though for your first adjustment. You went from like 30-ish pounds to the left side to 10, much more centered. So I just want to take the re-x-rays, make sure all aspects of the misalignment are better.
Okay.
Sometimes you got to go through 2 phases when you've had a lot of traumas in your life or a severe trauma to allow the body to hold and heal as quickly as possible. So we'll take those, we'll see what that says, and then we'll keep doing some adjustments and soft tissue stuff, therapies to just help those tissues heal. But just ice it. You know, I would ice base of the neck, 10, 20 minutes every day, 2-3 times a day if you can.
Okay.
Or just get in a cold tub and get your whole body in there. But we can help things go a little faster, and we can make sure they heal completely, but healing still is going to take some time.
Okay.
Hey everyone, so this is Alex's x-rays. We adjusted them, but I want to show you how we knew what to do. So this is his neck from the side view, or we call it lateral cervical, so his neck from the side. You can see total loss of curvature, head pushed out in front of the body. As far as positioning, his atlas is about 1/4 inch posterior from the EAM, external auditory meatus, which is the ear hole. It's also about 1/4 inch from the BBs, a little bit more. And he's pretty much right at the BB. So that's basically the bottom of the ear. And then how we're gonna adjust him is this right here. So his head tilt is 1 1/4 degrees. His lower neck is almost 3.5 degrees. His upper neck, his atlas is actually kicked down, so it's low on the left by a 1/16 of an inch. So we call this a kink pattern, where the head and the neck are kind of clamping down in the same direction. And obviously he's had a lot of trauma, he's in a lot of pain. Then vertex, I think we did it on this one. Good. So vertex, yeah, it's about 1 1/4 degrees anterior on the left. So the left has gone forward. So forward on the left, backward on the right. And also about 3/4 of a millimeter forward on the left is the second bone of the neck, the axis, or the neural canal. So, lastly, low back is straight. So eventually we expect his neck to have no rotation. Hips are level, basically. He's listing and pushing over to the right. So we're gonna use, for Alex, we're gonna use a sharp headpiece. So we're gonna, it's gonna go downward, so it's sharp, and that will help put pressure here, basically. So we're gonna adjust here, but by having a sharp headpiece, it's gonna help put pressure here to then push this top bone back over the neck, while also opening this the head as well. We're gonna come low. So we're gonna come low by about 2 1/4 degrees, or 2 1/4 inches, and then we're kind of posterior 1 1/4. So we're gonna come low and behind the atlas and adjust, and we'll we did that adjustment right away. His posture was better, his legs were balanced. He could even feel some improvement right away. Those are good signs, but we got to see if it holds. That's why we always like to post x-ray after a day or two. So we got to see if it holds. We'll check him, and then again, and then we'll x-ray him, and we'll go from there. We literally just do this. We stand with the light sustained pressure and angle we get from the x-rays, and the head and neck will slowly move. You may feel things, pressure changing, tension. Some people get some clicking and cracking, or you may feel nothing. Come on up.
Was that?
So that's NUCCA. I know it seems a little crazy.
No, like that was, like, did you notice my left hip kept falling backwards?
I didn't see that, but yeah, that can happen
Like
as those muscles relax.
Yeah, I was like, I just felt like I didn't have to hold it up so
exactly. That's because all those muscles are controlled right there at your brainstem, the very top of your neck.
That's a weird sensation when
Yeah.
there's no pressure right there.
And slide down just a little bit. Yeah, that looks way better there. Oh, just so much more relaxed.
Yeah.
So just take a few deep breaths. Let your body receive that. We'll check your posture. We'll do a few other type adjustments, and then you'll be good to go for today. And let's check you standing. Let's see. Sometimes it takes a little while. Sometimes you have to rest. Sometimes it changes right away.
Immediately, like 7-8 pounds different.
Yep. Yeah, only a couple. Wow. And you're so much. I mean, now maybe you're starting to fatigue and lean a little bit, but not bad. Now you're maybe a quarter inch left.
Yeah.
Versus, yeah, and you're only a couple pounds different. Come on out. So that's awesome.
Yeah.
It's a huge change, so I don't want to do too much, or a lot of times you won't hold it. But let's have you go face down. Let's do a couple other things.
All right. Yeah, my arms feel lighter.
Yeah, that's awesome. That's great. Now this, so the traditional adjustment doesn't actually move the bone, it releases tension. And if it's done well, there's benefit to that, but you're not going to change, your body carrying 30 pounds on the left to 2 or 3. Lift your right leg straight up. Back down, back down. Keep the knee straight and lift the right leg up as high as you can. Good, and down. And the left. And down. One easier than the other?
The right's easier.
Where do you feel it when you lift the left? The pain or the tension, the resistance?
The topmost part of my thigh by my hip.
In here?
Yeah, but on the front side too.
Oh, on the quad? Got it. All right. Let your legs be nice and relaxed. Just want to, yeah. So your hip is rolled backwards here on the left.
Mm-hmm.
So we're going to just, again, release a little tension. And the drop allows the friction to break, and you lots of times then get a better range of motion. Lift your right leg straight up. Good. And down. And the left. How did that feel?
The front part of my thigh didn't hurt.
Yeah. It seems crazy sometimes. Good. Okay. So a lot of change. So that's going to be good for your first adjustment.
Okay.
All right. You can come on up, and then we're going to definitely do some other things, but I want to let it hold. We could get you back in tomorrow morning.
Okay.
Right away. Any questions? All that makes sense?
Yeah.
Okay. So initially, the best thing you can do, we'll have you go rest for maybe 10 minutes here, and then go home and you can rest more, or just take it really easy tonight if you can.
Yeah.
And the reason for that is lots of times the muscles have been used to being out of alignment for years. The recent car accident, I'm sure, made it worse. But now they're going to be muscles, joints, they're all going to be functioning a whole new way. And if they get tired, a lot of times you just collapse back to what you're used to.
I feel like I'm seeing differently.
You could. Yeah, a lot of people, not a lot, but I've had people that the blurry vision, things like that, gets better.
Yeah.
You won't, what happens a lot of times is you don't even notice it after a while because it just becomes your new normal.
Mm-hmm.
So you're like, oh, but good, awesome. So let's go we'll take you up, have you rest, and we'll go from there.
Cool, man.
All right, hey everyone, Dr. FJ. We got Alex here. So Alex was suffering with neck pain, shoulder pain, knee pain.
Yeah, most recently from a car accident 2 weeks ago I walked away from, and the next morning after the emergency room I just haven't felt the same since.
Sure. It looks like the neck pain's been there for several years, so I'm sure the car accident made it worse. What kind of, are there any specific movements, activities that tend to make it worse?
So 7-8 years ago, I had a skiing accident.
Okay.
And I moved from snowboarding to skiing, and I slammed my backside onto a tree going, I don't even know how fast. So
Okay.
and but bending over, running, sitting down for long periods of time, just experience a lot of numbness and tingling, sharp pain from my neck, from my back to my wrists.
Okay. All right. And your job's pretty physical, so I'm sure it doesn't help with that.
No, it keeps me from being joyful while at work.
Yeah. Yeah. All right. Well, let's check you out. Let's get you fixed up here.
All right, cool.
So I'm going to have you, we're going to start. Let's take a look at your posture.
Okay.
So, yep, let me show you. We're going to go heels in the V's.
Okay.
Toes straight ahead, just looking straight ahead.
All right.
All right. Yeah, you can see your torso's about an inch and a half left of the pole. Pelvis is also, you're carrying about 30 pounds more on the left side of your body.
Oh my gosh.
Yeah, so that's by getting your head on straight, that's what we want to get fixed. All right, so come on out.
Okay.
Let me go write that down.
That's insane.
Okay. So the two main x-rays tell us how to adjust it. The two main things we're going to use visit to visit. Obviously, we're not going to x-ray every visit. So we already took some x-rays. Let's have you go on your back.
Okay.
But the posture along with your leg length, slide down, is what we use objectively. How you're feeling is obviously a factor, but sometimes you give it a good adjustment and it's so much change and you feel a little worse.
Mm-hmm.
Or sometimes you... Sorry, just checking this here. Slide up the table just a little bit for me, Alex, this way just a little. Right there, good. That should be good. Okay, your left leg's just your left leg's short. Okay. So anyways, so your left leg is just about a 1/4 inch short.
Okay. Yeah, I've noticed my strides and gait has definitely changed a lot.
And so what we want to see with the NUCCA adjustment, so when we're pushing on your ear, we want to eventually, we want to get, and sometimes the posture takes a little while for your body to kind of get used to it. The muscle memory has to change. We want to see you standing centered. Weight doesn't always get perfectly even. We want to see that better. We want to see these legs balanced and relaxed. Okay, then we know the adjustment's done what we want it to do. And if the x-rays look good, we'll post x-ray you as well. But if the x-rays look good, the legs are balanced, you're standing center, then you're where we want you to be. So then we don't need to do the NUCCA. We do other adjustments, which we'll do some today just to release tension, and we'll do some therapies to help the soft tissues heal faster. Okay. But the key is getting that head on straight so you're centered. And because you imagine we crack everything, that might release tension, but if you stay leaning like this, the pain's going to come back. It's just a matter of time. There's not going to be any lasting change. You're not really correcting anything. So we want to get it corrected and change how your body's moving through gravity. So anyways, sit up facing this way. Then you're going to come, lay. Let me get this set up. I'll get this out of the way. You're going to lay on your right side.
Okay.
Your ear is going to go in the hole. Shoulder, ear in the hole. Good. Perfect. Should be no pressure on the ear. So from your x-rays, we know we're going to adjust you 2¼ inches low and an anterior 1¼ degree. So I'm going to come right here.